19, and with millions gathering and traveling during these cold weather months as the holidays approach, respiratory illnesses are climbing across parts of the country, and health officials in one state are tracking a rise in pneumonia in children. ABC's Rena Roy has the latest.
It's that time of year again, much of the country seeing a rise in respiratory infections.
We're seeing an increased rate of children presenting to local emergency departments with cough, fever, runny nose, all these symptoms of common respiratory infections.
The CDC says 11 states plus New York City and Puerto Rico are experiencing high or very high levels of respiratory illness activity, including RSV, the flu, the common cold, and COVID.
The viruses that are causing these infections are not new. The reasons why they're coming in now is probably a multitude of things, including cold weather, increased travel.
The good news, children's hospitals across the country telling ABC they are managing their patient loads, and many are not seeing the same levels of RSV compared to the same time last year. Meanwhile, in one county in Ohio, health officials keeping an eye on an outbreak of pneumonia in children.
When you have outbreaks, what we're looking at is trying to see is if there's similarities. So is it just a coincidence that this many children had pneumonia, or are they all having it from the same thing?
Warren County, just north of Cincinnati, saying they've seen an extremely high number of pediatric pneumonia cases, reporting 145 children infected since August. The county medical director saying they were alerted to the rise by local school districts. And so far, the vast majority of kids are getting better.
We've had several districts, one or two in particular, that have been disproportionately hit.
The district reporting the most common symptoms include cough, fever, and fatigue. The average age of children impacted is 8 years old, but they have not seen an uptick in hospital admissions and no deaths. The CDC telling ABC News they're monitoring the situation, but there are no unusual patterns of pneumonia nationwide. Rena Roy, ABC News, New York.